A French pine tree for diabetic retinopathy. Back to nature. Diabetic.com. As a diabetic, you should get a yearly eye exam. Unlike a vision test for glasses, this test examines the retina in the back of the eyes. Eyes are dilated to look for damage to blood vessels, known as diabetic retinopathy, DR. If you are looking for a natural supplement to protect your eyes, a French pine bark extract may help. What is pycnogenol? Pycnogenol comes from the bark of a European pine tree. Pycnogenol is the registered trademark name for a French formula and is often spelled with the trademark symbol, as Pycnogenol. It's thought to be an antioxidant that helps protect cells from damage. And it's used in Europe to treat diabetic retinopathy. Research confirms the benefits of Pycnogenol. A study, conducted by G. D'Annunzio University in Italy, is published in the Journal of Ocular Pharmacology and Therapeutics. The study revealed pycnogenol can improve microcirculation, retinal edema, and visual acuity in the early stages of diabetic retinopathy. Previous research has shown that pycnogenol may reduce the progressing advanced stages of diabetic retinopathy, said Dr. Robert Steigerwalt, a lead researcher of the study. While previous studies focused on the latent stages of diabetic retinopathy, the aim of this new study was to show the protective effects of pycnogenol in the early stages of this growing diabetic complication. Pycnogenol has been intensively investigated for decades to stop the progression of diabetic retinopathy and help patients to maintain their remaining eyesight, said Dr. Steigerwalt. Our study suggests that pycnogenol taken in the early stages of retinopathy may enhance retinal blood circulation accompanied by a regression of edema, which favorably improves vision of patients. Pycnogenol may be particularly beneficial for preventing this complication in diabetic patients, based on the large number of individuals who were diagnosed when the disease had already significantly progressed. Other research confirms the benefits of pycnogenol. In 5 clinical studies with over 1,000 diabetes patients, pycnogenol was shown to improve capillary resistance and reduce leakages into the retina. Tolerance was generally very good and side effects were rare, mostly referring to gastric discomfort. In conclusion, treatment with pycnogenol had a favorable outcome in the majority of the patients with diabetic retinopathy. But the best remedy is always prevention. Most importantly, get a yearly eye exam and manage your blood sugar levels. Elevated blood sugar levels can increase your risk of diabetic retinopathy. Early symptoms are floaters, blurriness, dark areas of vision, and fluctuating vision. Luckily, advanced cases can be treated with laser treatment or surgery if caught early. Additionally, eye exams will also check for glaucoma and cataracts. While cataracts can cause cloudy vision and other symptoms, glaucoma is called the sneak thief of sight because it rarely shows any symptoms. An alarming statistic is that diabetic retinopathy, the most common form of diabetic eye disease, is the leading cause of blindness in adults aged 20 to 74. For that reason, we need to reduce the risk of developing DR. Below are 8 tips. Get yearly diabetic eye screenings. Take your medications as prescribed by your doctor. Maintain a healthy weight. Control your ABCs, A1C, blood pressure, and cholesterol levels. Don't smoke. Exercise. Do not exceed recommended alcohol limits. Contact your doctor if your vision suddenly changes and becomes blurry or spotty. Possible side effects and interactions. If you decide to try pycnogenol, let your doctor know because it may interact with the medications you are taking. Pycnogenol may cause dizziness, vertigo, and upset stomach. Pycnogenol may stimulate the immune system. So, it may not be safe for people with autoimmune diseases such as multiple sclerosis, lupus, rheumatoid arthritis, or other conditions. It's also not recommended for pregnant or breastfeeding women, due to the lack of research. In conclusion, diabetic retinopathy does not have to lead to blindness. Early detection and proper blood sugar management are the best remedies, and pycnogenol may help. Please remember this is not medical advice or intended to replace the advice of your doctor. This is not intended to cure any disease. Please do not self-diagnose. Always check with your healthcare provider before trying new treatments. Also, natural does not mean safe. Many natural remedies have side effects and can interact with medication and supplements. It should be noted that the FDA does not regulate dietary supplements but treats them like foods and not medication. Unlike drug manufacturers, supplement makers do not have to show their products are safe or effective. I ask you to please keep an open mind, be a diabetic detective and do your own research. Work with your healthcare team. See what works best for you, and monitor your blood sugars. Read more at backtonatureddiabetic.com.